welcome everyone. Today, I have a very special guest with us, Dr. Vikas, who has made us all proud by securing All India rank 33 in recent NEET SS surgical group. We'll be talking to him about his preparation journey towards NEET SS, the challenges he faced during NEET SS preparation, and his tips for future aspirants. Many congratulations, Dr. Vikas.
Yeah, thank you so
It's
much.
an absolute pleasure to have you with us here today. So, when the results were announced, how did you come to know? You were logged in and checking your results, or somebody called you and told you?
The results weren't expected. We had that given it before 30th of April. That was the date which was given. So I didn't expect that it would come on the night of 25th. I think, yeah, I remember 25th. So we weren't expecting that. No one was expecting that results would come on that day. So we were thinking that it would be coming on 30th itself. So it was a shock. I
Okay.
mean, I can say it was a sudden thing which we got to know. Yeah, which I got to know.
And what was your reaction when you heard your rank?
Quite excited. I mean, really thrilled. I all the efforts paid off. Actually, that was the reaction which was going on. Even like I never reviewed like all the questions which were recalled. I mean, I tried to review them as much as possible. There's always doubt in your mind whether you went with one option or the other. So you're always not sure about it unless you have reviewed it immediately after the exam. So that was in my mind, but still I was sure that I would score in a range of what I'd expected, and that was what which had come out. Yes.
Was this your first attempt?
No, this is my second attempt. So first attempt was in
Okay.
2023, just immediately after my MS. There
Okay.
I had got I had got a rank of 1031. Yeah.
See, nowadays, lot of people are moving away from surgery. So,
Yes.
why did you choose surgery?
Surgery, I felt the passion for surgery. It was just it was totally the passion towards operating the way the patients are. I mean, you see the results quite quickly. You know, if there's a tumor, you get it removed. You can see the results there. It's all about, and if you take proper care in the pre-op and the post-op period, in that way you can almost save the entire life. That's what fascinated me in medicine. I didn't feel that much of a thrill in giving medicine. I mean, they were it wasn't completely like a 100% outcome, good outcomes, or it's always a trial and error basis in a medicine department. Like you prescribe some drugs for few weeks or 6 weeks, see how the results are, or some people may respond, some people won't respond. But yeah, medicine has its own advantages. I mean, you get to diagnose the disease and all. But I what I felt was surgery was the thing which I had in my mind all the way long. Yeah.
But I look at in other way. No, if you want to become good surgeon, you also need to be a good physician. A
Yes.
physician need not know the surgical part, no post-op care and all those things. But as a surgeon, you need to know the
Mhm.
physician's job. No, like you also need
Yes.
to
Yes.
know how to manage hypertension a bit. You need to know how to manage a diabetes a bit. So coming to your preparation strategy, can you tell me how was your typical study day? Like how many hours did you study? What do you think was the best time to study? And I'm not sure whether you were working or you were like full time studying during your preparation.
I was working, sir. I joined Mysore Medical College as a senior resident. So what I feel was like you need to spend some time in the clinical in the wards. I mean, see patients in OPD, spend time in the wards. Make sure that your clinical knowledge is spent on seeing patient also. That way you will be updating yourself, or whatever the mistakes you're making, you will get to know them. So I made sure I did my job also, and simultaneously study also. So I used to spend initially around 4 hours a day, to study initially, and I mean, just I think 6 to 7 months before exam. After that, I kept on increasing the duration, and the last 2 to 3 months, I resigned from my job and studied, like sitting and studying completely.
Okay, and like during last 3 months, how many hours you need to study?
Sir, I think around 12 to 14 hours, I can say, yeah, around 12 to 14 hours.
Okay,
That much of
okay.
reading is necessary. You need to study the things which you have not covered and revise also. So that is required, sir. I think.
Talking further about your preparation strategy, Dr. Vikas, what were your standard textbooks you read? Like, and then when did you read it? Like during initial days, or were you still reading it during just before the exam? Like, what was your textbook choices for NEET
Yes,
SS
sir.
preparation?
I completed Bailey in Love. Then Sabiston. I made sure I read it 3 to 4 times at least. Yeah.
So, how many times did you read
Bailey
Bailey
in
and
Love
Law?
3 to 4 times, sir.
Okay, and did you make any notes, or you were like, just referring to
I
textbooks till the
didn't.
end?
All the part of it I couldn't make notes, sir. I mean, I did the major part of it. I think the important things and all.
And what about Schwartz textbook of surgery? Did you read anything in that?
Schwartz, I referred the images and for some chapters, sir, yeah, which was asked in the last year. So I made sure I completed that. But this time they are
Okay.
asked questions from Schwartz. The concepts were I knew all the concepts, but so that way I could answer the questions. But I think, yeah, maybe future they will be asking from Schwartz. Maybe.
So you mean like if you know the concepts and if you are not read one textbook, that is fine as long as you know concept. You don't have to have that photographic memory of
Yes, sir.
textbooks
Yes,
or
sir. It's
tables.
no more about tables nowadays. It is more about the clinical scenarios and the
Yeah.
like those type of questions. Yes, sir.
And then see nowadays we have a lot of apps and all to help you guys. We never had that. So like a lot of apps offer lectures, they offer
Yes.
notes, then they also offer MCQs. No, how like how did you which kind of things you used, and especially MCQs? No, how frequently you used to solve those MCQs? What was your strategy?
Uh, I made sure I used to solve MCQs as much as possible. Like whenever I had got time, uh, like there was nothing like a break I would like to take. Like whenever we used to make, we were three of us, so we had a group of three of us, like Dr. Vishal and Dr. Varun. So all three of us, we made sure we sit together, read throughout, because sitting alone idle, your mind won't be concentrating that much. So if you sit with someone else, you know what to read and you will be concentrating more. You can take small breaks in between, but whenever we are like in the night or in the early mornings, I used to make sure that I used to solve around 100 questions per day. So in the initial period, so I used to increase that later on the later days, as the exam came near. So at least 100 MCQs per day on the topics which I've read, or if you want to revise, that is a very good option.
What about mock tests? Like how many you solved? How many mock tests initially, and how many when you were nearing exam? What was your
Mock
strategy?
test, I used to make sure I used to solve at least two per day, two per week. I mean, because to review the
Okay.
mock test to take half a day, at least half a day of revision or reviewing would take. So you can't solve more than two per week initially. But later on, as the exam came near, I think during revision time, I used to make sure solve 3 to 4 per week.
How did you revise? Like you were saying, no revision time. How
Yes,
you
so
were nearing
as
exam?
I was saying, like, I used to make notes, or I would try to write things up in the textbook itself, like make sticky notes, or if there's an image, there usually images are big in standard books. Try to write it down at the side. What are the important things you need to know from that page? So by that way, while reading that page, you'll know only to read that image and read the things which are written on the side. That is what revision means. I mean, you need to revise the topic in within 1 or 2 hours. Just go through the page and see what are the things you have written, because you will obviously be able to grasp it as early as possible. I mean, just seeing it is enough because you know you have written it and all. And some flowcharts I used to practice it. I mean, write it down somewhere else, or make a sticky note, make it easier way, remembering in a easier way. So all that I used to make sure.
Then see, like you prepared and you had some idea how difficult the exam would be. So like when you went and
Yes.
sat in the exam, like when you finished the exam, we have for pain we have something called as
Yes.
visual analog score, like VAS score, no, like
Mm.
0 to 10. Like for example, what did you feel when you finished the exam? How difficult was the exam? Like from the scale of 1 to 10, what did
Sir,
you
I
feel?
felt that the difficulty, rather than the difficulty of the exam, it was this time the pattern was like 50 questions, 50 minutes. So the time frame of it,
Yeah,
50 questions were divided into three sessions. So once 50 minutes and 50 minutes is done, the questions
yeah,
can't be reviewed again. The section is lost. I mean, you can just answer 50 questions in that 50 minutes. Once it is done,
yeah,
you will have to go to session 2 because you can't come back to session 1. That was this new thing which was introduced this year. So we weren't adjusted to that
yeah,
thing because 150 questions, 150 minutes was that we were solving. Like I used to solve all the questions as quickly as possible, come back and review those questions which I had doubt. But this time when this new thing was introduced, I didn't
yeah,
have time. So in the first session, I made sure I did it as quickly as possible. And always I feel like I used to feel that the first answer is your best choice because that is the choice which you have taken out of your knowledge, not with when you start to think, read the question again or think about it again, there is a matter of doubt which comes again, and that way you will be forced to put the wrong answer. So that was what my opinion is. So when I used to read the question properly, initially I used to read it word to word properly, understand the question, put the answer, and go to the next one. So I didn't like solving these many. I have solved at least 30 to 40 at least mock exams. Given that, so by doing that, I got to know that I was making more mistakes after reviewing. So I made sure I didn't come back and review it again. So these were things which I had made sure I had developed
yeah.
it before. So based on these, I felt that it is not too easy. The exam is not too difficult. Some questions are easily solvable, some questions you need to think, and the time frame given is apt. I mean, you can't have more than 1 minute. 1 minute is enough because the questions are not too lengthy, not too short. So it actually is a test of how you have prepared yourself and how do you read the minor things in the questions. What is the clue you need to take it out? So all those things are tested there. Sir. That is what I felt. It's not like a very difficult one. It's solvable, but you need to be very careful. That's what I feel.
So, like, you think the questions were like, see, we have basically one is applied kind of questions and then
Yes.
memory based questions, no, like most common, least common. So, you feel it was more of concept based, no? How do you apply certain thing what you read in the textbook in your clinical practice?
It was
Was it like
applied
that?
based only. So what I previous year questions and all which I had solved, they were more of knowledge based or fact based questions. Now it has been applied based. It is they give a clinical scenario, very common scenarios in what super specialty clinics you see. So all those clinical scenarios will be tested. So like as much as possible, I think 150 question is way too less to test everything. But as much as possible, yeah, maybe
Yeah.
some might be lucky to get those questions or the concepts which you had seen in the clinical rotational period. So that way would have helped for many like that. So it's not just the book knowledge, but how we have applied the knowledge in on patients or how is that applicable to the patients. That's what is tested there, sir.
Like when you are like solving those 50 question block, no, were you left with any time or it was like 50 minutes done and you are done with questions, like, or did you have any time to go back and check?
First session was quite easy. I mean, was quicker. So I got around
Yeah.
8 minutes, I think, to go back and review the questions which I had the doubt. Some the second session on, it was a bit difficult, sir, to because I didn't have that time to go back and review it. So I think I was left with 2 or 3 minutes. So in that, I think one or two questions I could just review it back. But I was sure that the first answer was the right one. But so I didn't make that mistake of going back and changing. So that was there. So, yeah.
And how was the day of the exam? Like, were you able to sleep well in the night? And then how was, like, how early you late you reach the exam hall? And do they allow anything to take inside, food items, chocolates or something if you feel
Uh,
hungry? Like, did you have lunch? Like, how was it? Your day,
So
exam day.
I could sleep well. I mean, sleep is necessary. I mean, your preparation is done. That is
Okay, you were not tensed. Like I hardly used to get like sleep one day before exam. No.
that was the idea, sir. But actually, I had the mentality that I have prepared. So all these efforts is done. I
Okay.
mean, your preparation is done now. Get a good sleep, because that one day is what that matters at the end. So if you are not sleeping well, if you are
Yeah.
mentally not alert, then you might end up solving wrong, giving wrong answers. So I made sure I slept well, made sure I had good breakfast. It was in the exam was between 1 to 4. That was the timing. So I
Yeah.
personally, what I feel is, I even though if I'm hungry, I could manage that, sir. I don't want the lunch hours is the thing. After lunch hours, post lunch hours is where you get sleepy. So I didn't want to eat much, or eat something and feel that dizziness or sleepiness in the during the exam. So I had a late breakfast, like a brunch. I can wait till 4 or 5, so that then I can have something. That's what I was feeling. I felt.
When I gave USMLE, they used to allow us to take some food
It's here. It's
items.
not
No.
allowed, sir.
If you feel hungry in the middle, you can.
Not allowed. Nothing
It's
is
not
allowed.
allowed. Okay.
Even they didn't allow
Okay.
chains also, rings.
Okay. And like anything you do to, because now when you are giving exam, you are on a hot seat. So anything you do to keep yourself calm, just like practicing mock tests throughout the year, that keeps you calm, or is there anything you do to calm yourself during the exam time?
I used to meditate, so like at least 10 minutes of just sitting idle, closing your eyes, keeping your mind blank. It will help you calm down, obviously help you think better. It will remove the anxiety in you. So that helped me a lot. Even during exam, there's a buffer period, like when the gate closes half an hour before the exam starts. So by the time, you'll always be, I think, 1 hour or 45 minutes before the exam starts. So that time is very important. I mean, I just sat there, had a close my eyes, just meditated around. The thing is, before the exams, you shouldn't think a lot. You have to keep your mind blank, because you don't know what questions will be coming. So when you read the questions, some answer flashes in your mind, and that is what the answer will be, because you would have read about it. It's not like your preparation will be good. It's not reading it again and again and thinking a lot will make you think the other way around. So you might be ending up answering it wrong. So that's what I felt. So keeping my mind blank and just going with the first question as if my mind is completely blank.
You have some gut feeling, or you have some sixth sense which tells you what is the right answer. That's But that all comes like
Yes,
when
sir.
you read, and then you saw a lot of
Yes,
MCQ. No, finally you reach that stage that you can guess
exactly,
what
sir.
is the
That's
right
what
answer.
the
So
preparation is should be that much that you don't have to doubt in yourself, because you would have solved similar questions before. You know the gut feeling, or you know that if you have done a mistake, you would have corrected it. So that way, you are quite sure that this way, this will be the answer. But again, reading it again and again will make you doubt your first option. So that shouldn't be the way of answering.
yeah.
The preparation should be to that level. That's what I feel.
Yeah, you spoke about meditation. Like, you have been meditating for a long time, or you just started as a part of, when you're preparing for NEET
Uh,
SS.
I've been not like a regular basis, sir. Since senior residency time, there was not much of stress. I couldn't do like daily, but once I started to prepare, I made sure I used to meditate, so that you calm your mind. That stress is always there, so make sure you calm yourself before going into the before reading and everything.
Any particular like way of meditation you follow, or like just
Closing
closing
your
your
eyes,
eyes and
concentrating on the
sitting
breathing.
somewhere?
That's what I used to do. So if you just forget other things, concentrate on your breathing, because you're already studying so much, you're under so much stress. Like, you have to come. You would have thought that this is what I had to do today, or I had to do yesterday, and I haven't completed that much. It's obvious that you don't complete the things which you had thought or you had planned out. It's not 100% usually. So you'll always, those thoughts always keep running in your mind. So I made sure I concentrated on my breathing to forget those things for that 10-15 minutes, and then proceed with whatever I had to do.
I don't know, maybe early, like end of this year or early next year, there will be next need. So what will be your advice to all those people, no? who are going to prepare for next NEET SS. So any like important points which you followed or you forgot to follow them? No, you want your the next people no who are going to appear to follow them very strictly. Anything you want
I
to tell
stick
everyone?
on to the textbooks. That's what I feel. So like your textbook gives so much knowledge. They have been everything is incorporated in that. Every scenario, what they have seen in the clinics and all those things are given in the book. So you have to read it so many times that you get out all those information which is there in that. That's what the importance of reading it 3 to 4 times or 4 to 5 times. Those hidden things. I'm sure that Bailey and Love, even if I read it now, I get some new things out of it. That's what I always feel like. So well it is written. So these books are really like fascinating. That's what I feel. So like so many things, so much knowledge, so much things are given in the book. Sometimes many people would prefer notes and all, but I feel handwritten notes will always help because you're writing it from the textbook, a source which you have always relied on. Those things, that is what I would advise. Like make your own notes, read textbook directly, and all the people like examiners will be taking questions from in and around from these books only. It won't be something new or something new study which has happened recently which will be asked. They won't try to make it so difficult. So it will be a well-known things which are known to everyone. So it's all given in the books. That's what I would say. So like read the books and make your own notes. So all MCQs daily,
Okay.
whenever you have free,
So
whenever you have time. That's it. Yes,
so you already got your dream seat
yes.
surgical oncology. So did you always wanted to do surgical oncology or you decided after getting how was the decision made? And then like anything after this, like I know like now you are enjoying because you got your dream seat. Like you have any plans for future?
What I feel is if I'm going to settle in a tier one city, I need to subspecialize in some organ, or I will be, I should be able to do a fellowship in from specific topic which I feel would be interested me in the 3 years. So I have to keep my options open.
Any particular inclination you have which
So
organ?
mostly it's GI onco. That's what everyone while studying would have. So that's what I feel. So like it might be even thoracic oncology or like esophagus or lung. Maybe it might change. I don't know. But I'm open to subspecial. I mean to do fellowships further, also study further. That's the need of the hour. That's what I got to know from all the things I've seen.
I'm sure no, you will figure out no what is your interest and
Yes.
then definitely you will choose. Nowadays, like it's all
Yes.
organ
Yes.
based specialization, no. So you'll choose one and probably excel
Yes.
in that field. Okay, so that's it from
Yes.
my side, Dr. Vikas. Thanks for your time. We wish you lot of good luck. Both of us are in Bangalore, so if you need anything, just get
Sure,
in
sir.
touch
Sure,
with
sir.
me. Thank
Thank
you
you so
for
much,
your
sir.
time.
Yes.